Okay. Here we've already explained this stomach sample in a separate video. Here we wanted to explain this mainly the large intestine and part of the small intestine as well. But first we wanted to put it in the real model so that you can imagine its position. So here we can see the gastroesophageal junction, okay, and lower down the junction of the pylorus with the first part of the duodenum. Okay, so now we're going to remove the stomach because we don't need it. Alright, and here, as you can see, if I remove this, this is the duodenum. Alright, and this is its junction with the jejunum. See if we can place it back here, right there. Okay, so this is the junction. And of course, here, the arteries, because I don't think we've explained this sample, we can explain it later in a separate video. Okay, so first we have this sample. We can begin with, again, this is the duodenojejunal junction. Okay, we cannot see the rest of it, so we're moving on to the large intestine. These are coils of the small intestine, but they're not really distinguishable. The large intestine, here's the cecum. Okay, you can see a depression in its lower end. You can see this depression. This is the site of the appendix. And from embryological origin, the appendix is actually, at birth, it's attached to the caudal end. But because of the disproportionate growth of the wall of the cecum, you can see that it turns slightly posteromedially. That's why you see it near the caudal end of the appendix, of the cecum. Here. Okay. At its junction with the ascending colon, we have the entrance of the ileum. Okay. And this is, as you can say, the ileocecal valve, or junction. Above it we have the ascending colon, and in the colons we have the tenia coli. Even in the cecum they are supposed to terminate at the appendix. It's not visible in this sample, I believe in the other one. So here, this is one of the tenia coli. This is another. Okay. This is just the muscularis externa, histologically. And this is the third one. Okay. They're not uniting, it's just for purpose of illustration. And if we go higher up, here we reach the hepatic flexure. We can put it back there with the liver, but it will take time. It sits right beneath the liver. It's called the hepatic or right colic flexure. It's just the transverse colon until near about here. This is part of the midgut. From here it becomes the hindgut, distal third or the second half. And this is the splenic flexure, or the left colic flexure of the descending colon. Here we have the descending colon going down until it terminates at this sigmoid colon. And yes, this is also just descending colon. There's no sigmoid colon here. We can say that here on the sample, this is the junction. You know, look at this. This is the descending colon. This is its junction with the sigmoid colon, and this is the sigmoid colon going down, becoming the rectum. Okay, and the tenia coli terminate at the rectum. They're supposed to, at least. So these are for the intestines. For the blood supply, some of these branches, I'm not sure, but it's likely. First of all, of course, this is the, if we put it back here, this is the left side, okay? So if we go to the left side is mainly supplied by the inferior mesenteric. So this is supposed to be the inferior mesenteric artery. And again, this is supposed to be the left colic with its two branches, ascending and descending, the sigmoidal, and this is supposed to be the superior rectal branches. Okay? On the right side, we know that mainly the right side is supplied by the superior mesenteric, so This is supposed to be the superior mesenteric. Its origin is higher. So as I said, this is not clear. It gives branches like the middle colic, okay, the right colic, and again, as I said, I'm not sure. And this could be the continuation. It could be the ileocolic branch, or this is the continuation and it joins the ileocolic branch. Okay, and this is going from this side. It's the superior mesenteric vein. Okay, so I don't know what this vessel is. If we move on to the sample, the model itself, again, you know, some things are obvious, like the esophagus or the aorta, the trachea. That's not our concern. Here, in the abdomen, this is the esophageal hiatus, the level of T10. This is the abdominal, the aortic hiatus, in the diaphragm meaning, at the level of T12, and the caval opening is supposed to be located near here, T8. Here, this is the spleen, okay? And we can see the entrance. This is the spleen. You can see the entrance of the splenic artery, and it's divided into many branches. It's supposed to be about 6 branches. And this is the splenic vein, draining it and going back. Here, this is the celiac trunk. This is the aorta. This is the celiac trunk, T12. Okay. Yes. It gives off the left gastric. So if we bring the stomach back, put it here, and this part, the left gastric, is supposed to go up, supply part, the lower third of the esophagus and the lesser curvature, upper part of the lesser curvature of the stomach. Here, this is the continuation of the left gastric. Okay, and we have. So this was the first branch. The second was the splenic. The third is the common hepatic. This one, only this small segment is the common hepatic. It divides into the hepatic proper, and the continuation is the gastroduodenal artery. Okay, and again, this one is supposed to be the right gastroepiploic artery, because if we bring the stomach back here, and yes, it's very obvious. It goes directly to the lesser curvature of the stomach, so it continues as this artery. Yes, as the greater curvature of the stomach. How do I see? And okay, so the other one going down is the superior pancreatico-duodenal artery, right between the duodenum and the pancreas. Superior pancreatico-duodenal. Where does the inferior pancreatico-duodenal come from? From the superior mesenteric artery. It's not obvious here. And okay, these are for the arteries. So this, of course, is the portal vein. And this is the bile duct, the common bile duct. Maybe if we can bring the liver back. Yes, this is the liver. So it's like this, and you can imagine it. Join this with this, hepatic artery with this, and the bile duct with this one. So I don't know if you can really join it. Yeah. If you can take a closer shot, you can see it. Okay, let me. This is the hepatic artery here, and this is the hepatic artery here, proper. Okay, and as you can see, it's divided into left and right branches. Okay, if we go down and join it, this is the portal vein here, and this is the portal vein here. Okay, this is the bile duct, common bile duct formed, and here this is the bile duct formed from the cystic duct and common hepatic duct. Okay? Okay. And other things. This is the kidneys. This is the suprarenal gland, the left one. This is the right one. This is the apex. This is the upper part of the left kidney. Of course, it's higher. Why? Because of the liver. And again, this is the renal pelvis. Is divided into major calyces. From the major calyces, you have minor calyces. These are the papilla, and so on. Regarding the blood vessels, the major vessels, we said this was the aorta, descending thoracic aorta, still the aorta. You can take it from this shot. Then it's emerging from the diaphragm, given the celiac trunk. Then lower down, this is the level of L4, bifurcating or trifurcating into the two common iliac arteries and the median sacral artery. Here's the median sacral. And of course the common iliac arteries divide into the internal iliac here. Okay. And also on this side, this is the internal iliac artery. Part of it is derived from the umbilical artery. And this is the external iliac, and becoming the femoral artery as it passes behind the inguinal ligament, visible on this side. I don't know what this branch is. And this is the gonadal artery coming down, again on the same side, on the other side. Could either be testicular ovarian. I believe this is its male sample, so it's testicular artery. And this is the femoral nerve, also going down. It's outside of the femoral sheath, if you remember. And this is the lower limb. Could be the deep circumflex iliac, but anyways, yes. We have the ureters, this one. Now if we trace it back to the renal pelvis, we come down, this is the ureter. And down, down, down into the bladder. Just the location of the bladder, the same on the other side. Okay, the muscles, this is the quadratus lumborum. For the nerve supply, just for as a reminder for the exam, all of them are supplied by the lumbar plexus, okay, even the quadratus lumborum. But of course not the transversus abdominis, its nerve supply is different, just like the external oblique and internal oblique, really from the lower sixth thoracic and first lumbar nerves. This is the iliacus. More specifically, it's supplied by the femoral branch of the lumbar plexus, femoral nerve. This is the femoral nerve passing between them. And if you remember from lower limb, we said the femoral nerve passes between the psoas and the iliacus, directly in the groove between them. So this is the psoas muscle. It's supplied by the lumbar plexus, and they are going with the iliacus to the lesser trochanter. This is the iliac crest. Everybody knows this. And this is the diaphragm here, part of it. Okay, if you can pause. Okay, we've forgotten about the duodenum. Of course, you know this. The first part located here, second part, third part, and fourth part in its junction. But the pancreas, this is the head of the pancreas. You can see it's, in the C-shaped curvature of the duodenum. This is the uncinate process. This part, the uncinate process with the lower is embryologically the ventral pancreas is two buds. Just for purpose of your as a reminder for the subject, the dorsal bud goes and it faces posteriorly and the ventral bud anteriorly. So when the ventral bud rotates posteriorly, it becomes the uncinate process. That's why the superior mesenteric vessels lie behind the pancreas, the main body of the pancreas, except for the uncinate process. Because if you can imagine, the uncinate process comes from the ventral bud. It is initially like this. So as it goes posteriorly, the vessels come to lie in front of it. Okay? Yes, by the way, these are the superior mesenteric vessels, artery and vein. And this is the head, the body, and the tail of the pancreas going to the hilum of the spleen. And this is the sympathetic trunk. Okay, and I believe this is the azygos vein training into the superior vena cava. Okay, so.